regulate your body's temperature. Number 11. Hair on the surface of tongue shows poor oral health. Epstein-Barr or HIV. One of the rarer changes to your tongue presents as a surface coating that has the appearance of a black, brown, or white fur, which is known as hairy tongue. Those hairs are not actually hairs, but long strands of proteins that catch food and bacteria over time. Usually, hairy tongue is simply a sign of poor oral hygiene, and you should find it goes away naturally when you brush or scrape your tongue. However, if you notice that your patches of hair are white in color and you're struggling to scrape them off, you might have something called oral hairy leukoplakia. This is usually a result of a viral infection like Epstein-Barr, a type of herpes, or even HIV. Number 12. Black areas of the tongue is normally due to smoking or antibiotic use. A black tongue is usually nothing to worry about. You'll often find that it's a result of a buildup of dead skins on your papillae, the tiny areas of your tongue that contain your taste buds. Some of the most common causes of a black tongue include the use of some antibiotics and smoking. If you have a black tongue, it's normally accompanied by some surface fuzziness or hairiness. It may also be accompanied by bad breath and a metallic taste in your mouth. To treat a black tongue, you usually only need to brush your tongue regularly with a normal toothbrush and cut down on your smoking habit. Number 3. Burning sensation can be caused by a dry mouth, infections, diabetes, acid reflux. A burning sensation in your tongue and mouth can be a sign of all number of health issues. If your tongue feels like you've scalded it on a hot drink and tastes metallic or bitter, you might have something called burning mouth syndrome. This could suggest an issue with the nerves in your tongue, but can also be a sign of health problems like dry mouth, infections, acid reflux, and diabetes. So how can you check your tongue for these conditions? Examining your tongue need only take seconds of your time. Try to make it a part of your routine, like brushing your teeth or combing your hair, so that you're less likely to forget. There are no secret or difficult elements to checking your tongue. Simply stick it out as far as it'll stretch and stand in front of a mirror. Lean in close for a better view and check that everything looks healthy. Generally, if your tongue is sort of soft pink color with a thin white coating, it's healthy. Look out for any of the signs mentioned in this video, and if a particular area is painful, investigate further. To conclude, ultimately you should make a visit to your general practitioner if your tongue is displaying any unusual symptoms, especially if pain is involved. Your tongue is a part of your body that you shouldn't notice, even while it's working. So if it's on your mind for any negative reasons, it's best to do something about it. Your tongue really is cleverer than you give it credit for, and it's important to look after it for the sake of your overall health and well-being. Make sure to brush it regularly to maintain good oral hygiene, using a tongue scraper if necessary, and drink plenty of water to help wash away any excess bacteria. Make regular dental appointments and speak out if something doesn't feel right. If you want to know where to buy the best tongue scrapers, then click here. I hope you've enjoyed this video on what your tongue reveals about your health. If you have, please subscribe to this YouTube channel and don't forget to give this video the thumbs up. And I'm sure you're going to enjoy this next video on the
Good afternoon, everyone. Good evening. Good evening na pala.
Good evening
Sorry.
po.
Good evening po.
Okay, so tayo-tayo pa rin. So tuloy tayo sa ating pag-aaral. Tonight, we are going to take up red, dry, and cracked tongue. Pero crack na nasa center ng tongue. Okay? So focus tayo ngayon sa tongue na may crack sa center, red and dry. Okay? Yung stomach, meron siyang very important role sa pag-produce ng energy and fluids. Okay, if you remember, this is the only hollow organ, the only young organ na nagpipresent ng true yin deficiency. Okay? Then konektado siya sa mga 5 yin organs. And the stomach is described as sea of fluids and grains. Okay? Ang solids kasi, pati liquids, nire-receive yan, pinapabulok, pinapahinog ng stomach. Okay? And para maganda yung function ng stomach, kailangan niya ang damp environment. Kaya meron tayong kasabihan, the stomach loves dampness and dislikes dryness. Kaya mga Chinese gusto nila ng you always start your meal with something that is hot, some soup, no? Soup na hindi rin tuyo. Ang stomach condenses the impure part of essence sa food. Okay? So, di ba yung pure, bumababa yon, papunta na sa mga tissues. Yung impure naman, kinocondense ng stomach. Okay? Ito ay nagiging part ng body fluids. Okay? And then the tongue coating reflects the quality ng stomach chi and yung damp environment sa stomach. Okay? So kailangan ang stomach may damp environment. So ano ang sign na healthy ang stomach chi? Dapat meron siyang thin, white, and moist coating. Okay? Thin, white, and moist coating. Okay, so pag kumakain tayo ng masyadong madaming fried food or toasted food, kaya wag nyo nang tustahin ang inyong mga bread, no? No more bread toaster. Hot spices katulad ng curry, chili, pepper, mustard, yung sobra, no? At saka hot drinks like coffee. Meron siyang drying effect sa fluid sa stomach. So, di ba, as much as possible, hindi tuyo or may fluid pa yung stomach. In the beginning, pag mahilig ka nitong mga pagkain na to na nakapagpapatuyo, yung center ng tongue nagda-dry. So after a while, kung patuloy ka pa rin kumakain ng ganong klaseng pagkain, okay, so nasisira na yung stomach yin. Okay, so ibig sabihin matindi na ng konti. And this is reflected in the different signs in the tongue. First, una-unang mangyayari, yung center will become dry. Okay? So, anong ibig sabihin nito? Meron na tayong slight deficiency ng fluids. Okay? So, kung naging red po ito, meron ka ng stomach heat. Okay. So, that means, when you look at the center of the tongue, pag nag-red na po yan, stomach heat na po yan. Okay? So first, kailangan pag dry yung tongue center, slight deficiency lang ng fluids. Pag nag-red na siya, meron ng stomach heat. So pag ang pathogen ay nasa stomach and spleen, ang person will suffer from pain in the muscles and flesh because stomach and spleen is supposed to nourish the muscles and the flesh. So remember, ang kalaban is nagko-cause ng obstruction, yung external pathogenic factor, no? So pag pumasok yan siya, magkakaroon ng stagnation sa channel. So sasakit yung muscles mo and flesh. Okay? Although wala ka pang problema sa stomach and spleen, the mere fact na masakit na yung ating mga kalamnan, sign na yon na nag-uumpisa na po. Meron na pong pumasok na external pathogenic factor. And if you are familiar with the stomach and the spleen channel, so I think you already know where the pain is. Okay? Now, pag yung yang chi ng stomach is sobra. So, sobrang yang. At saka yung yin naman ng spleen is kulang. sa opposite magkakaroon ng sensation of heat sa center and yung tao parating gutom. Okay? So magastos ito. Ito yung tinatawag na stomach yang qi excess spleen yin insufficiency or spleen yin deficiency. So ang isang tao na nagsasuffer from stomach yin deficiency, okay, magkakaroon ng constipation, dry mouth and throat, and thirst. Pero ayaw niyang uminom ng tubig. Remember, yin deficiency, hindi ka pa masyadong gustong uminom ng tubig. Thirsty ka lang. Okay? Small, irregular, or horizontal cracks. Okay, so familiar na po tayo dito. Pag sa center ng tongue, meron ka nakikita ang mga cracks. Okay, pwedeng maliliit na crack, irregular na crack, or horizontal cracks. Plus, maputla ang tongue. Ibig sabihin, so deficiency po ito. Nagsisimula na onset of stomach yin and fluid deficiency. Okay? So stomach yin deficiency, stomach yin deficiency and fluid deficiency. Nagkakaroon na ng mga cracks. Maliliit na cracks, irregular or horizontal cracks. As long as yung tongue is pale, that is still deficiency. So yung crack pwedeng mag-appear na mabilis dahil sa improper eating habits. Pero the moment you change these eating habits, mawawala din po yung crack. Kaya it is very important that we also advise the patient on the diet. Okay? And we are very fortunate kasi meron po tayong, nakita nyo naman yung effect no, ng Quantumin, di ba? Yung meron siyang fulvic substance, fulvic minerals na nagdadala ng nutrients sa kinain mo. Okay? Or nagpo-provide siya ng nutrition sa atin, especially yung miramin Q. Diba? So, ang cracks sa mga red tongues are deeper compared sa mga so pag nakita natin malaki na yung crack, definitely alam na natin na red yung tongue. Minsan kasi yung pagkakuha natin ng picture will reflect it. So, bias na lang tayo. So, pag malalim yung crack, definitely red yung tongue. Because yung yin deficiency is now accompanied by heat. Okay? Mainit na, kaya malalim na. So, deficiency or lack of fluids, magkakaroon ng insufficient tongue coating. Okay? So magkakaroon ka na ngayon ng peeled appearance or meron siyang irregular distribution, katulad ng tofu, no? Yung parang kalat. Okay. If these types of coatings appear specifically in the center of the tongue, sure sign na yan na meron kang stomach yin deficiency. So center of the tongue. So ganitong klaseng coating. Ano yung klaseng coating? Yung parang peeled appearance or parang geographic tongue, yung parang irregular yung distribution. So sa stomach yin deficiency, yung tongue coating sa gitna ng tongue, the center of the tongue, will be especially affected. Okay? Pwede siyang peeled, okay, or dry, or without root. So in kidney yin deficiency, we have a rootless, irregular-looking coating na mas widespread. And usually, ang tongue is red. So do not ever commit the mistake of saying na kidney deficiency na siya. Not unless red na yung tongue. So kidney deficiency. Now let's go to the cases. So yung tongue description, kung nakikita nyo, maputla yung pale red siya.
Remember yesterday when I
pero mayroon na siyang crack sa gitna. No?
I'm actually going to eat it
tonight. So pag pale red, that means kind of deficiency pa po siya.
I was actually
wala pa siyang
getting
siya. So peeled yung gitna, ibig sabihin wala nang
I remember
red.
there was a story
another description
heard
is
from my friend.
yellow
We had a
greasy coating
conversation
sa
yesterday.
sides.
Sabi kasi niya, yung isang friend niya,
Take note ha, greasy
may sakit
coating.
daw.
So may dampness na po
Tapos,
siya.
tinanong
Yellow.
siya, Ma'am,
Do you
anong
remember,
gamot mo sa
Ma'am
ganito?
Teresita?
Tapos bigla daw
Pag
sinabi sa
yellow,
kanya,
greasy
para
coating,
mawala yung
ano
sakit
yung
mo,
pattern?
maghanap ka ng
Dampness, Doc.
bagoong.
Damp?
Yung
No,
Barley
yellow
Fiesta
pa
na
rin. May
bagoong.
yellow na. Damp.
Ay,
Tapos kainin mo yung
damp
3/4 na
damp
parang
heat.
Na. Okay, tingnan natin kung tama
1/3
mamaya.
ng bagoong sa
So, pag
kutsara.
peeled, ang
Tapos,
center,
pagkatapos daw
red,
nun,
cracked,
okay na yung
ano po siya,
pasyente.
Ma'am Betty?
Hit na po siya.
Hindi, ano pong specific na organ?
Stomach and spleen
Yeah, stomach yin deficiency.
deficiency.
Oo. Wala pang kinalaman dito yung spleen.
Masarap ang
Kasi kung
bagoong pag may
spleen,
mangga.
usually malapad siya.
Matambok.
Matampok. Pale red, so deficiency. Saka bakit may red anterior third? Ano sa palagay niyo ang problema rito? Merong
Emotional problem, Doc.
okay,
Yes.
probably. Or, so far the symptoms, so wala kang sinasabing ano. But anyway, let's take a look ha. Bleeding gums, alam na natin may kinalaman ito sa stomach. Diba? Naaral na natin yan. Mouth ulcers, mainit. Dry stools. So dry stools, hindi po soft stools. Ang soft
Sa stomach in.
na stomach gid. Very good.
Stomach.
Vaginal
Barrio Fresh.
discharge.
Yes.
Sa
Barrio
kidney na.
Fiesta ang bagoong.
Damp na siya.
Konti lang.
Deficiency.
In the posterior burner, in the lower burner, red face. So, baka may
Breaks
hit na
anterior.
lumbar pain. Okay, lumbar pain is back pain. So definitely, ang kidney. Tingnan niyo po yung kidney. Medyo parang lupa na. Tingnan na natin sa diagnosis. Yung pasyente, walang diagnosis sa Western. So, I'm sure gumastos ito ng malaki sa laboratory tests. Okay, so yan po ang nabakala natin pag hindi tayo nag-aral ng background sa disease, physically overworked. So, tingnan natin yung mga diagnosis muna. Okay. My diagnosis ito na normal. So, but I don't think this is normal.
No.
Okay. Tanggalin na natin siya. Minsan kasi yung book is nuloko yata tayo. Anyway. Stomach yin deficiency with heat in the stomach. Bakit heat in the stomach yin deficiency? Dahil may crack, wala ng coating. Pagkatapos may heat sa stomach. Bakit natin nasabing may heat sa stomach?
Red in the stomach.
Makula.
Okay, mapula na po ang center ng tongue. Very good. Accumulation of damp heat in the stomach and heart.
Greasy. May yellow coating.
Okay. Kasi kung ito dito po, stomach pa rin po pala yan. Hindi naman ito lahat yata. No? Pero ang nangyari kasi, pati yung nasa likod, okay, so kasama pati yung, okay. Kasi kung nakikita nyo, meron din siyang dampness dito, damp heat. Heat in the upper burner, especially in the heart.
Because of the red heat.
Yeah, late evening meals. So hindi pala maganda ang late evening meals. Matulog na lang o ng tubig. In abuse, kailangan hindi na magkape kasi lalong umiinit yung sa. So meron po tayong case history. The same patient, 51-year-old Catholic nun. She worked for charity organization since the age of 20. So 31 years na din siya nag-work. The work and life in the cloister drained her. She tried to fight off continual fatigue by increasing her intake of coffee. Kasi gusto natin gising tayo. Ate very little at night before continuing to work for several more hours. Okay, she often suffered from mouth ulcers, So that explains the
This
ano sa
deficient.
upper burn and bleeding gums, no? Daily bowel movements, pero ang pulse niya very dry. Yung tongue niya, ill red crack center. Yung pulse was slightly rapid and frail. So yung tongue center na walang coating, okay, typical sign daw yan of stomach heal deficiency. Take note, tongue center na walang coating. Okay? Pag may nakikita tayong small cracks sa area mo, pag ang mga cracks kasi, isipin natin kaagad na natutuyo na. So, weakening na ang fluid sa stomach. Okay. Ang cause po daw nito is late evening meals and chronic overwork. So, kung ayaw natin magkaroon ng cracks doon sa gitna, that signifies weakening of fluids. Kasi po, lalo na pag yung kinakain natin, medyo toxic din, no? So, nauubos yung yin, gabi kasi. Okay. Now, this and excessive intake of coffee, nagbigay ito ng stomach heat. Okay? So, pag may stomach heat, mapula po yung area na yon and pinapagalaw niya ng vigorously ang chi and blood sa stomach channel. So, pag gumagalaw masyado, yung chi and blood sa stomach channel, so umaakyat po siya pataas, no? So since teeth and gums are situated along the yang brightness channels, remember, ang stomach pati large intestine, parehong polarity yung channels nila. Ito yung tinatawag nating yang ming channel or yang brightness. Okay, so injury to these channels by heat could well result in bleeding gums. So it always follows na pag meron tayong nakitang red po sa stomach area, since ang stomach pati ang large intestine, they belong to one channel, the yang ming channel. Mag-expect tayo na mainit din yung kanyang pagdumi. So kaya constipated siya. Okay? And we will have bleeding gums kasi nandyan po yung stomach and large intestine channels dumadaan. Okay, incessant mental and physical overwork plus yung heat sa stomach, ina-agitate niya yung heart. Okay. Kasi po, pag mainit na po yung stomach, di ba stomach yang na? Sino ba yung mother ng So maiinit din, maiinit din, ma-agitate din yung yang ng heart. So pag ang heat naging excessive, nagiging fire na po siya. Pag fire na siya, this will injure the tongue and this will cause small, red, painful mouth ulcers. So ibig sabihin, kaya nagkakasugat-sugat tayo sa bunganga dahil po yan sa mga pinagkakain natin. Saka umalat na sa heart, naging heart yang na. No? So it is interesting to see kung paano in the beginning, ang redness na nasa center ng tongue will later spread sa tip ng tongue. Okay. So yung heat sa yang brightness channels also involves the large intestine. This and the underlying stomach deficiency are responsible for dry stools. Yung slightly rapid na pulse reflects heat. A frail pulse, ibig sabihin weak yung pulse niya, it indicates chi deficiency dahil sa overwork. Punta naman tayo sa 39-year-old female naman. So kung nakikita nyo yung tongue niya po is reddish. Okay? Who would like to comment? Sige, basahin nyo po. Sino po?
Reduce deep crack in the center. My kidney and deficiency siya, Doc. Field coating at the root. Oh, yeah. Kidney deficiency. Red of tongue, red edges. Red tip.
Okay, ano ibig sabihin po ng deep crack in the center?
My kidney and deficiency.
Stomach.
Involved na po yung kidney, di ba? Kasi
may crack din.
Yeah.
Stomach
So,
deficiency.
and kidney yin deficiency. Very good.
Ang root niya is filled.
Ito, meron po itong significance, no?
Yes po.
Nag-curl up, slightly red edges. Anong ibig po sabihin kaya niya? Tapos yung red tip, alam na po natin, master po yan ni Ma'am Betty.
In love.
Okay. Napansin nyo, pwede na natin din sabihin, no, pag red yung tip, talagang emotionally affected yung patient. Kasi tingnan nyo, meron na pong depression. Yeah, essence and yin deficiency. Okay. Red, itchy, dry skin at the neck and face. Bakit kaya red, itchy? Okay, sa may neck, sa face. So think of the channels na pumupunta dyan. And sensations of heat in the body, depression, dahil po ito, alam nyo lahat daw klase ng emotion, sabi ni Machocha, ang nakaka-feel niyan, ang heart una. Then biglang kakalat dito. So yun, katulad ng anger, kaya marami pala no, inaatake sa puso. Una mo na maapektuhan is the heart. Kahit yung fear, no, let's say, I have one patient, ewan ko kung nalaman ito ni ano, wala yata nakakalam. Nasa Basilan siya nakatira, Lamitan. Meron siya 25 hectares na ano, tapos since may pera sila, akala ng mga abusaya magbibigay. Diyos ko, ayaw niya magbigay. Alam niyo, 3 o'clock, 4 o'clock in the morning, pumunta yung mga abusaya kasama yung husband. Pinugutan ng ulo sa harap niya. Can you imagine? Alam nyo, ever since, hindi na nakakatulog pag ganong oras yung pasyente. Parati na siyang hindi, basta imagine kasi yung pala talaga, no, pag may problema na yung puso, depressed ka, syempre pugutan pa naman ng ulo yung asawa mo. And then, alam mo, nag-dialysis siya, namatay din siya after 3 months. So, how bad? Kaya dapat yan na, grabe, no? How some people can be so heartless. Okay, occasional feeling of tightness in the chest. So, di ba, pag may tightness sa chest, may pressure na ng konti. Are we speaking of? Kasi alam ko ito, may significance po ito eh. Any comment, Ma'am Teresita?
Emotional, Doc? Emotional problem.
Okay. Yeah, emotional. Deep crack in the center. Deep crack talaga. So, ibig sabihin, pulang-pula talaga yung dila.
Stomach deficiency, Doc.
Yeah.
Malalim siya.
Ito po yung Western diagnosis niya. Atopic eczema. Okay, kati ng kati. Allergic rhinitis, allergic asthma.
Correct na, stomach deficiency, kidney deficiency. May kidney deficiency siya, Doc, dahil may field coating na ang kanyang root.
Yeah, yes, correct. Kaya dito, may kidney deficiency, meron na siyang stomach deficiency, right? So, ano pa po?
Liver chip.
Doc, dahil po sa crack na at the center of the tongue. And
okay. Unhappy marriage, you see? Repressed emotions, okay. Yung ito grupa pala, kung nakikita nyo, itong, tinan nyo, parang in-emphasize talaga yung side, nag-curl up, diba? Liver chi stagnation or liver chi constraint na nagkaroon na ng heat sa liver. Kung papansinin nyo, meron kayo nakikita, tinan na to, pareho na po pati sa feet. No? Heat in the heart, heat in the liver with liver chi constraint or liver chi stagnation. Slight heat in the blood. So yung 4 levels, nasa blood level na po siya. Diba? Yung weight chi level, chi level, the nutritive or yin level, and then the blood. So, kaya nangangati na po siya. So kailangan na po siyang tanggalin natin yung heat. O in-nourish natin yung yin, di ba? Tingnan nyo ha, yung stomach yin, kidney yin, meron na siyang liver,
Liver.
heart, practically everything is affected. Does it make sense?
Yes.
Yeah. So ito po yung case history. Si Mrs. F nag-suffer siya from atopic eczema since the age of 25. Whenever she encountered emotionally difficult situations, may mga taong ganyan, no? Nag-turn red kaagad yung skin, nagiging dry, and kumakati. Her skin was particularly red around the neck and face. For many years, she used large amounts of cortisone creams to improve the appearance of her skin. So yung marriage niya proved to be a great strain on her as her husband became mentally ill. Imagine magkaroon ka pa naman ng husband na
Wow.
okay. She was very anxious and fearful and unable to express her frustration and anger.
Balik po ako, Dok.
Okay. So, sige, mamaya pakinggan natin, madam, yung inyong confessions. Okay, okay, now I know. Okay. In general, she felt very unhappy and experienced signs of deep depression. Okay, isang tanong, madam, if you don't mind, you may answer or you may not answer it.
Okay
Do
lang.
you have a happy marriage, Ma'am Teresita?
Dok?
Happy ba yung marriage mo?
No, unhappy, Dok. For
Okay, end of question. Okay. Sige, titingnan natin ulit yung tang mo. Pahanapin ni Ma'am Betty bakit naging unhappy ka. Okay. Ay, naalala ko, marami kang crack, madam. Malalalim.
Yes po, sa gitna. Vertical cracks lang, Dok, sa gitna.
So now we're learning. No? Okay, tuloy. Di ba sinabi niyo may asthma rin kayo?
Yes po, noon. Pero
See, as a child, ito
Quantumin.
kasi pagkabata eh. She
Wala.
experienced...
Yes po, since pagkabata pala. Because of my strain in the Dok, in the shoulder. Kung sa Bisaya pa kung malunhat, panuhoto, namuto, mag-ubon lang ko, Dok. Hindi maya ko nito.
As a child, okay, she experienced frequent asthmatic attacks and acute bouts of allergic rhinitis, but they rarely manifested in adulthood. Ganun din ba kayo, madam? Hindi na nag-manifest kung tumanda kayo?
Wala man na Dok, since pagbata until age 50, may asthma pa man din.
Okay. So, tingnan nyo, the reddish tongue showed a very deep crack in the center and the tip was very red. Her pulse was very rapid. So, grabe ang heat. Thin and slightly wiry. So, yung energetic condition ng pasyente, meron po siyang deep constraint of liver chi with development of heat. Dahil po sa kanyang unhappy marriage.
Yes po, curled up talaga.
Yeah. Tingnan natin mamaya kung mahanap natin yung dila mo, madam. Kung talaga the curled up and slightly red tongue edges confirm this diagnosis. Okay. So the next time we see, pag nag-curl up na yung tongue sa sides, tapos dito natin masasabi na mayroon na siyang liver chi constraint with heat. No? They often appear when long-standing emotional problems cannot be resolved. So, dito, yung heat in the blood is mainly responsible for condition of her skin. Nagkaroon ka ba ng mga itchiness, madam? Wala?
Yes po. 3 years.
Talagang relate na relate?
3 years ago.
Wow. Okay. So, ibig sabihin, talagang pumunta na sa blood level talaga yung mga toxins, no?
Oo.
Okay. So, over many years, kaya pala medyo dry, ang dami yung crack. Now we know. So, blood and fluids in the superficial layers of the body were injured by heat, manifested as dry red skin. This woman was always sick as a child, had weak constitution. So, ito, pati yung kanyang mga cortisone creams, yung mga steroid for over 20 years, were the main factors underlying. Parang naalala, binigyan ni kayo ng steroid, madam, no?
Yes po, manakatik, nag-ano ako ng steroid.
Okay. These were the main... kaya nagkaroon ng weakening of the stomach and kidney yield. So yung rootless coating po ng dila nito is an important indication of their deficiency. So pag may deep crack sa center, it reflects stomach yin deficiency. The
Ito po
kidney yin
ito.
deficiency and internally generated heat disturb the organ's harmonious communication with the heart. Kaya nagkakaroon ng anxiety and depressive states. So nagkakaroon po ng disconnect yung heart, nagkakaroon ng disharmony yung heart and kidney. Okay? Kaya nagkakaroon ng anxiety and depression. I think you can relate to this very much, no? Rapid and thin pulse denotes heat from deficiency due to lack of yin. The wiry quality suggests liver qi constraint. The center of the tongue dapat po moist, dapat may thin coating. Pag may stomach yin deficiency ang pasyente, cracks or dryness will appear in this area. Okay. Yeah. Improper diet. Okay, ganito ba yung diet yung good for, madam? Eating in a hurry.
Talaga do.
Siguro kumakain kayo alas 9 na ng gabi.
Tapos kung ano-ano na lang kakainin.
Yeah.
Na-correct lang yun, Dok, yung sinabihan mo na ako na bawal ito, good ito. Yan.
If the tongue body color is pale or pale red, stomach yin, okay. So, hindi pala sa lahat ng cases na yung stomach yin deficiency pwedeng masolve. So, kung pale lang po ang dila, no? Pwedeng mag-regenerate ang stomach yin within weeks or months.
Eating in a hurry.
Yes. If these tongue signs appear with a red tongue body, it indicates stomach and kidney yin deficiency, suggesting that the healing process will take longer. So thank you very, very much. Okay, bago tayo pumunta kay Ma'am Teresita, punta muna tayo sa sinabmit ni Ma'am
Noemi.
ni Ma'am Roxanne. Thank you, Ma'am Roxanne, for this. Okay, so meron siyang 40-year-old female patient. She complained, lahat naman, back pain, shoulder pain, with headache. Siguro sumakit ang ulo dahil sa pain. Okay. Anyone who would like to diagnose? Medical history. Ano po ito, madam, degenerative this disease? Degenerative
disease? Ano ba yan?
Degenerative. Okay, so...
degenerative.
Okay, so anyone who would like to... Una-una yung tongue niya, hindi naman...
Very
hindi
shiny.
Tapos may teeth marks, no?
Yes, teeth marks, so...
Glossy.
Purple man ang tongue. It increase blood stagnation, pero ang sa sublingual veins parang wala din, hindi man stagnated. Bakit ba yan?
Pero yung veins niya po mahaba.
Okay.
Oo. Hindi lang masyado na-emphasize. Hindi naman siya dilated. Pero I think ang cause po nito hindi ang stagnation. It's the phlegm. Kasi yung phlegm po, pwede po siyang mag-cause ng pain. Di ba? Kasi kung titignan mabuti, kasi pag may shoulder pain, cold and dampness. So kung nakikita nyo, cold na cold talaga yung dila. Ang kapal pa ng coating. Di ba? Yan. Saka kung titignan nyo sa may kidney area, medyo tuyo, medyo na siya, medyo matanda na ng itsura.
Old 14.
Yes, and 40-year-old, and I think siguro sa dami ng gamot na ininom, no? At saka may degenerative disc problem siya. Degenerative joint, degenerative, okay. Okay. So this means na meron talagang issue yung kidney niya. So I think this is a classic example of kidney yang deficiency. Bakit natin sinabi? Kasi po maputla ang dila, malaki, and definitely meron po siyang spleen qi deficiency or kung malamig yung kanyang kamay and paa, spleen yang deficiency po yan. And I think na because of the yang deficiency, naging phlegm na siya, and it is the phlegm that is causing the pain. Because phlegm can obstruct circulation, both of chi and blood, right? So we don't see anything.
Totoo. Meron akong case dati, Doc, na bigla na lang para bang akala ko na stroke kasi nawalan siya ng sobrang dami nung phlemas niya. Hindi naman mataas ang BP. Phlemas siguro yun.
Okay. Hanapin ko yung ni... So kumusta na yung patient, Ma'am Roxanne? Hindi ba siya O, di ba? So, yeah, thank you very much, Ma'am Roxanne. Please update us kung ano nangyari. Ito yung dila po ni Ma'am Teresita. Kaya pala, ito ang lalim-lalim ng kanyang puti. Yung, diba, mayroon na tayong natutunan. Talagang meron po siya, naka-elevate po yung kay Ma'am Teresita po ito ha. Super elevated yung sides and tip. Do you follow? So there is really heat, liver chi constraint and liver heat. So full of anger. Tapos ang lalim-lalim po, tuyong-tuyo po yung gitna. No?
Yes.
Okay, so I think you have been very unhappy for the past 20 years, Ma'am Teresita.
Yes po, totoo po yun.
Longer. O, di ba? Tapos meron na siyang yung parang nagpo-falling hair na ba kayo, madam?
Yes po, Dok, matagal na. Akala ko sa palipat-lipat ako na shampoo o conditioner. Akala ko sa sa conditioner na ginagamit ko. Hindi pala.
Ito pala ang reason bakit ko po tinanong yon. What am I driving up?
Ay, sa kidney yun.
Essence.
Kidney essence deficiency. Katulad ng pasyente ni kaya nagkaroon siya ng degenerative disc disease, no? Essence din po yun. Okay, so hinang-hina na yung essence nyo. Sa totoo lang ito yellow na. Ngayon we're beginning to see a clear picture, di ba? So nakakatulong talaga yung ating what's this? Itong ating nightly meeting. And we would like to acknowledge the presence of Dr. Gavino.
Wow.
Kinarir namin. Thank you for inviting
Dr. Gavino. Welcome po sa ating tongue check session.
Good evening po.
Thank you
for coming.
We are really honored by having you around. Kasi, this is something na I hope, and I feel that, I think you agree with me, no, that this can really help us save a lot sa medical expenses. And this can already warn us or tell us what to do. Hindi yung, ganun lang pala. Ganun. So, di ba? Do you agree, Ma'am Noemi?
Yes po, Doc.
Miss Unstoppable, you promised the tongue of your mother.
It's already in Ma'am Roxanne's,
Okay.
nasa GC na natin.
Sige. Ka muna? Mag-adlib ka muna, magpapakita. Sige, ko muna. So, kumusta yung mother mo, Ma'am Naomi?
Kanina lang, mga alas 6, she talked with the cardiologist, yung kanyang doktor nung na-hospital siya. Kung titignan mo yung status nung kumbaga, the well-being, improving actually kasi today, hindi siya inatak ng hingal. Kung umatake man yung sikmura, yung bang siguro seconds lang, tapos hindi rin grabe, Tapos mahaba ang tulog. Di ba kahapon ng hapon sabi ko mahaba ang tulog. May napansin lang ako kagabi habang nag-therapy ako sa kanya. Parang 2 nights na to na may lumalabas na plemas, parang di maputol-putol mula sa kanya. Kagabi ako, biglang nagkaroon ako ng sipon na parang nabablock talaga yung aking nostrils. Parang ganon. Sabi ko, siguro dahil ginagamitan ko din siya kasi ng mga gadgets natin na hindi lang kasi needles. Yung talaga hands-on. Tapos, basta this morning, maganda yung tulog niya kagabi. Tapos, maganda naman yung kain niya. Nitong hapon na nga lang na medyo, sabi niya, umatake na naman daw yung sukot niya. Pero basta, very short lang yung time span. Nitong alas 6 na, syempre, tinignan na ngayon ng doktor yung kanyang laboratory test. Ang sabi lang naman ng doktor, first is, wala naman daw doon, hindi ko alam kung saan doon yung test na nag-check kung magkakaroon siya ng heart attack. Wala naman daw. Tapos, yun ang nga sabi ng doktor, diba, sabi mo, Doc, na dapat nag-improve naman na siya ngayon kasi kinausap mo siya ng doktor, no? Pero yung may sinabi ang doktor na sabi niya, ipapaswab si mama, baka daw COVID. Sabi ko, Dok, sa lahat naman namin nung nagkasakit kami, siya lang naman di nilagnat, siya lang naman di inubo. Ngayong after naman lang nung therapy natin, lumalabas yung plemas niya. Though dati, di ba, kung titignan natin yung kanyang dila, alam natin na ang daming plemas sa loob ng katawan niya. Ang kapal ng coating May dampness. Ngayon, natawa nga ako nung sinabi niya, papapaswab ba ako? Sinabi ng doktor Mabuti na nga rin din yung makita natin yung status. Di ba? Pero nung pagtingin ko sa dila niya kanina, hindi ko alam kung makikita niyo yung difference. Basta dito, sabi ko, nung tinignan ko, sabi ko, mas malinis na siya kaysa nung una ko talagang tinignan.
Ito na ba?
Yes, eto na yun.
Okay. Ma'am Teresa, do you want to comment?
Sandali.
Sa totoo lang talagang matambok itong anterior third.
Oo, no? Parang hammer nga siya talaga.
I'm sure nahirapan itong huminga, nahirapan itong humiga.
Hindi siya nakakahigado. Ano yan siya?
May chest pain ka, Ma'am Naomi? Chest pain?
Nung first day lang, ma'am, nung first attack na medyo humihinga talaga siya, nasabi ko nung night, na yung sabi ni Doc, ready your needles, kasi dapat is admit na siya. That time lang, ng chest pain siya. Ngayon, kahapon wala, ngayon wala.
Kasi sobrang thick ang dila niya sa anterior third.
Oo, ito super taba. Pati lateral
Saka may mga black spots.
Hindi siya diabetic, Ma'am Naomi?
Hindi ko alam, Doc. Kasi hindi, di ba, hindi siya diabetic. Pero nung June 6 na confine siya, o June 5, na-test siya, yung bumaba yung kanyang sodium at saka yung potassium. Tumaas yung sugar niya that time, 233. That was the first time. Hindi ko na alam kasi di ba na hospital siya. Sinabihan ko naman si Dr. Singh na mataas yung, syempre nakikita naman nila yung result. Ngayon din, hindi naman din siya hininga nung para sa sugar. Sa test niya, tinignan ko, 11 na tests yun sa laboratory.
Okay,
baka mataas ang sugar sa totoo lang. Kasi tumaas na yun ng di ba sabi ko, yung sa sublingual niya, sabi ko, natakot ako nung isang gabi kasi this was the kind or the picture of the bago siya na ospital. Ang dami-daming parang blood clot sa ilalim ng dila.
So anong plano mo, Ma'am Naomi? So far okay naman siya. Nakakatulog ba siya ng mahimbing?
Ngayon, so far, mula kagabi, kahapon kanina, ang haba ng tulog niya sa umaga. Tapos ngayon, tulog na naman siya. Actually, hindi na siya yung bang malakas boses ko ngayon, no? Or,
I think kailangan talaga mag-bed rest, mag-complete bed rest, no? Kasi talagang, saka one side no?
Bukas siguro kasi yun man yung ano ng doktor, no? Sabi niya, meron man siyang gamot na binigay. Yung tatlo yun ang maintenance daw. Dati kasi may losartan yan. Nung isang araw, nung hiningal siya, tumaas siya, nag-148/78 siya. Di nagbigay kami ng losartan kasi yun yung maintenance niya before. Sabi ni Dr. C ngayon, hindi na kailangan kasi okay lang daw yun. So, hindi kailangan losartan. Yung binigay niya na gamot, yun na lang. Ano ba katanaw na ba sa kuanbi? Sa ihang reseta? Reseta sa una? Oo. Kasi yun lang naman yung magdagdag lang daw siya ngayon ng pangkalabnaw ng dugo. Kasi nga kung COVID, delikado daw. Tapos, at saka antibiotics. Sabi niya, makikita ko in 3 days or in 2 days time kung viral or bacterial siya kasi despite the antibiotics daw na ibigay niya, kung COVID cough yan, sabi niya, mag-worsen.
Oo nga grabe yung comorbidity niya, madam. Sige lang, pray lang tayo and I hope you can manage her very well. Pinaka-concern natin dyan yung damp retention, yung swelling. And dapat marami ng phlegm nilalabas.
Ay hindi masyadong madami, Dok. Pero pagka sa gabi na yan lumalabas mga alas 12 or mga alas 2 kaya. Sabi ko, kasi nagigising siya Tapos yun na nga, kagabi akala ko nag-vomit siya. Sabi ko, nagsuka ka ba? Sabi niya, hindi. Lemas. Sabi ko, sige, good. Mas mabuti na yan. Kasi sabi ko, baka yun din yung dahilan ng obstruction sa'yo. Hindi makalabas-labas yung lemas mo.
Okay, mahilig siya kumain ng ng matatamis. Mga hilaw.
Oo, Dok, yung ating coffee, naglalagay pa yan siya ng sugar. Sabi ko, oo.
Sige. Basta wala ng coffee muna siguro kasi naglalagay pa siya. Kasi
wala siyang gana din ng coffee ngayon. Wala nung nagkasakit kami. Ang dami na nga niyang supply kasi may supply yan siyang 10 boxes a month ni Girly. Ngayon, sabi ko, dami mong kape Kasi hindi na siya ganun kahilig. Dati, ang hilig-hilig niya, kada kain, nagkakape yan, nagsusugar.
So, try to do something, mag-read ka about how to deal with stagnation. Talagang blood stagnation ang problem.
Blood stagnation talaga problem niya.
Okay. So,
thank you so much.
Thank you very much, everyone. It was another learning moment for all of us. Maraming salamat kay Dr. Gavino na talagang
salamat sa pakikinig sa amin.
Gusto ko lang matuto.
Nagbibit-bit ng mga problema dito kada gabi.
Actually, we're all trying to learn here. Kasi I believe na the only way to learn is to really take a look at different tongues and textbooks, yung mga nakikita and how they explain the science. Okay? Maraming salamat po sa lahat. Stay safe. And pakikuha na lang yung pictures ng inyong mga tongue bago gusto nyo mag-donate. Okay, Joe.
Thank you very much.
Thank you so much, everyone. Good night.
Good night.
Keep safe.
Ingat.